everyone. My name is Erica DiRuggiero.
And I'm Ophelia Michaelides from the Center for Global Health at the Dalla Lana School of Public Health, University of Toronto.
And we have a question for you. What does a healthy and sustainable city look like to you? And what could this possibly have to do with global health? Well, it turns out quite a lot. A projected 5 billion people, or 60% of the world's population, will live in cities by 2030, which makes urban health a matter of global health. And we're not the only ones who think so. In September 2015, Canada and 192 other countries adopted the 2030 Agenda for Sustainable Development, a global framework for action for people, planet, prosperity, peace, and partnership. It outlines 17 Sustainable Development Goals, also known as the SDGs, 169 targets, and over 230 indicators, all with a guiding principle of leaving no one behind. We have 10 years to meet these goals, and there are a number of areas where Canada is lagging behind, and in some cases, moving backwards.
Welcome to Healthy Cities in the SDG Era, a podcast where we'll talk about the Sustainable Development Goals and how we can achieve them. We'll be unpacking the SDGs from the perspective of a global health-focused centre at an academic institution in Canada's most populous city, Toronto. We're recording from Toronto, or Tekaronto, on the traditional land of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples. The territory was the subject of the Dish with One Spoon Wampum Belt Treaty, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. This meeting place continues to be the home to many Indigenous peoples from across Turtle Island, and we are very grateful to have the opportunity to work on this land.
Throughout our episodes, we'll be focusing on research and policy topics related to SDG 3, Good Health and Well-being, and SDG 11, Sustainable Cities and Communities, and the ways in which they work with the other SDGs. For example, areas like poverty, hunger, gender equality, decent work and economic growth, reduced inequalities, and climate action. Now let's get to know each other a bit better. So my name is Erica DiRuggiero, and I'm the director of the Center for Global Health and an associate professor at the Dalla Lana School of Public Health. My research examines how evidence affects global policy agendas related to employment, other determinants, and health equity in the context of the Sustainable Development Goals. I also study the health and health equity impacts of policy and program interventions at the population level.
And my name is Ophelia Michaelides. I am the manager at the Center for Global Health, a public health professional with experience in global health and health system strengthening and a track record of building globally influential communities and partnerships. Having worked in the public sector, NGO space, and academia, the focus of my work has largely been on program design, implementation, evaluation, and collaboration. So you might ask, why are we making this podcast? And it's a great question. Firstly, we think these conversations are important. They affect us all, and we hope our discussions spark ideas and topics to discuss in your own networks too. As a Center for Global Health, we are a hub of knowledge in global health research and education. We operate within a top Canadian school of public health and are located in one of the most diverse cities in the world. Combining our location and Canadian values of equity, universal healthcare, and social protection, we know we can make an impact on the Sustainable Development Goals.
The rest of the University of Toronto, or U of T, community is also on board. In 2017, the university created the President's Advisory Committee on the Environment, Climate Change, and Sustainability as a part of the response to calls from faculty, student, and climate organizations for the university to divest from direct investments in fossil fuel companies. U of T is also among the top producers of research on the SDGs globally and ranks third and fourth in the world among universities for the volume of scholarly publications related to good health and well-being and sustainable cities and communities. Throughout this podcast, we will feature the expert perspectives of U of T faculty and students. Our goal is to give context to the ongoing research and progress towards achieving the SDGs at U of T as it relates to Canada's actions and to add new perspectives to our national discussions. Our conversations will be evidence-based and focus on action and impact. With the knowledge and all in our own unique way, we can take one more step towards achieving the SDGs.
Healthy Cities in the SDG Era is made with the support of the School of Cities at the University of Toronto, whose mission is to bring urban-focused researchers, educators, students, practitioners, and the public together to explore and address complex urban challenges. You can find Healthy Cities in the SDG Era on Spotify, Apple Podcasts, SoundCloud, and the Dalla Lana School of Public Health's YouTube page. Join us for our next podcast in the coming weeks, where we'll talk about why the SDGs matter to Canada and how academic institutions, such as U of T, can play a role in achieving these goals. Thank you for tuning in, and we look forward to speaking soon. Take care.